The upper limbs are examined usually in the seated position. And today we're going to start with the upper limbs. The order of examination is always the same for both upper and lower limbs. It starts with inspection, then we do tone, then power, then coordination, then reflexes, and lastly sensation, in that order. On inspection of the upper limbs, having exposed the limbs and our patient in the seated position, we inspect them. The inspection involves the hands, the forearms and arms. We look for the following: muscle wasting, fasciculation, or what we call muscle fiber twitching, abnormal posture, abnormal skin markings, or any other deformities that strike us. We examine the limbs effectively in two positions. The first position is the prone position. Can you place your hands on your knees? And we look carefully for any obvious wasting or the things that I have said. Then you ask the patient to turn the hands over and look in the supine position, particularly for wasting of the small hand muscles, the thenar eminence, the hypothenar eminence, or the small muscles of the hand, the forearm, and the arm. In this case, Ben's examination is normal. The next part of the examination of the limbs involves tone. The most important part of this examination is to relax the patient. So you get the patient in a comfortable position. Are you comfortable, Ben?
Yes.
Yeah. And in the upper limbs, we examine tone at the elbow and the wrist. We bend the arm or flex it fully and extend it fully in a passive manner, all the time looking at the patient's face so that we know if we're causing any pain. I'll repeat that maneuver. We then flex and extend the elbow fully. In this case, tone is normal. The examination is continued at the wrist. In this case, we look at the patient's face and bend the wrist backwards and forwards, feeling for resistance. In this case, there is no resistance. Ben's tone is normal. Finally, we can do another maneuver which is called supination and pronation. Again, testing for tone and checking for passive resistance. In this case, supination is normal and pronation is normal. So after inspection and tone comes power. This is often the most difficult part of the examination of the upper limbs for students. It's very important to remember that you should test for power actively before you test for it passively. By actively, I mean getting the patient to do as much as they can first. Ben, can you elevate your arms over your head? In this case, Ben's power looks normal. In order to begin the examination for power in the upper limbs, we instruct the patient to take his elbows out from his sides. Ben, please take your elbows out from your sides and hold them up in that position. I'm going to press down on your elbows. Please push up and resist my movement. He's able to fully resist any attempts to press his elbows down. Abduction is normal. To test for power at the elbow, we ask the patient to hold the arm with the elbow flexed at 90 degrees. Then hold your arm up in that position. Very good. To test for flexion at the elbow, then please pull against me. And this is normal. We can see the biceps contraction. Push against me. Extension of the elbow power is normal. Please hold your arm out straight with your fist closed. Now don't let me push down. I'm checking for extension at the wrist. Now I'll check for extension at the knee. Push up against me. Turn your hand over and make a fist. And don't let me straighten your fingers. Hold your hand out straight. Don't let me push in against you.
Okay.
And you press in this manner. So hold your hand in that position. Bring your thumb up towards your face. Now push against me. And he's able to resist the movement. So Ben, are you comfortable?
Yeah.
We're now going to test for coordination in the upper limbs by using the finger-nose test. So Ben, I'd like you to hold your right arm out fully stretched away from you in a horizontal position. With your eyes open and looking straight ahead, I'd like you to touch the tip of your finger to the tip of your nose. So do that slowly. Repeat that again for me. Now we'd like you to do the same on the left side. And repeat it a little faster. So that's sufficient. If we suspect there is any coordination, we can make the test more difficult for Ben by the following maneuver. Ben, I'd like you to touch my finger and then touch your nose and touch my finger again. Touch your nose and touch my finger again. We can even make it more difficult by Ben by moving my finger. So Ben, please touch my finger, touch your nose, touch my finger, touch your nose, touch my finger, touch your nose, touch my finger, touch your nose. Watch for accuracy and repeat the test on the other side. The next part of the examination of the upper limbs involves testing for reflexes. In this part of the examination, it is very important that the patient should be relaxed. In this case, Ben looks relaxed. It's also important to flex the arm to 90 degrees. You place your index finger over the biceps tendon and you tap it. In this case, you can see that his forearm is contracting. To test for the triceps jerk, you hold the forearm in the flex position and tap the triceps tendon. And here you see a brisk reflex. The final reflex is the supinator reflex. You leave the arm in the same flexed or semi-flexed position as you did for the biceps jerk. You place your fingers over the forearm in the following manner and you tap. And you look for a slight contraction in the forearm. To demonstrate reinforcement in the upper limbs, it's important to be able to distract the patient. The way we do that is ask the patient to grimace or concentrate on his jaw muscles. Then, can you make with your teeth? Now he's distracted. I can now tap his biceps jerk again. And in this case, you see a slightly more obvious reflex. We do the same with the triceps. Again, slightly more obvious reflex. And now the supinator. And in this case, probably a more obvious reflex. If reflexes are absent, please check by repeating the reflexes with the patient reinforcing in the manner that I've demonstrated. The last modality of examination of the upper limbs involves sensation, and in some ways this is often the more difficult part of the examination. The reason is that the information now has to go through the patient. Therefore, we must communicate clearly with our patient. It's also important that the patient be relaxed and the patient understand what you're trying to do. In testing for sensation in the upper limbs, it's important to ask the patient, have they any loss or alteration in sensation? Ben, have you lost any sensation in your hands or your arms or your forearms?
No.
No. Ben, I'd like you to say yes when you feel me touching you.
Yes. Yes.
Ben is now trained. Now Ben, I'm going to test sensation in your upper limbs, beginning with your fingers, but I'd like to do it with your eyes closed. When you feel me touching you, please say yes.
Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes.
So Ben, was there any difference between the right and the left side?
No.
And did you feel the sensation was as strong on your fingers as it was on your arms?
Yes.
Ben's sensation is normal. We've just demonstrated light touch, which is an example of superficial sensation. We could also have tested pain and hot and cold. Now we're going to move on to deep sensation. Deep sensation has two modalities. One, joint position sense, and two, vibration sense. I'd like to demonstrate joint position sense. I'm going to move your fingers up and down, and I'd like you to tell me which direction they're moving in. This is up, and this is down. But I'd like you to close your eyes when doing it. I'm going to start the examination. The important thing is to remember that you have to grip the distal part of the finger at the sides, not at the top and bottom. Now, which direction am I moving it?
Up. Down.
Let me check the other side, please, the left hand.
Down. Up. Up.
You can open your eyes. So Ben's joint position in his upper limb is normal. The other modality of deep sensation that we routinely test for is vibration sense. In order to demonstrate vibration sense in the upper limbs, we have to do it as follows. Ben, I'm going to put a beating tuning fork on your collarbone. I'd like you to tell me when you feel it. Okay? You can have your eyes open. Do you feel that now?
Yes.
Okay, now close your eyes. Tell me when it stops.
Stopped.
So Ben is now trained and knows what to expect. I'd like to continue now with the examination involving his upper limbs. Ben, I'm going to test vibration sense in your fingers. Now, place the vibration. Do you feel that?
Yes.
Tell me when it stops.
Stopped.
Please give me your left hand. Feel it?
I feel it.
Tell me when it stops.
Stopped.
If vibration sense was absent or diminished in his fingers, I would move to a proximal bony point, which would be the metacarpophalangeal joint, or the wrist joint, or the elbow joint, or indeed the that's